So, let's talk about something pretty wild. Imagine your doctor tells you there are no more medical options left for you. It's a devastating moment, right? But for some patients in Ireland, that's not where their story ends. An investigation has actually uncovered this hidden pathway to some really advanced therapies, a kind of secret back door that opens right in their own country. And this quote really gets to the heart of it all. Can you just imagine hearing those words from your doctor? It would feel like a final verdict. But here's the thing. What if it wasn't the end of the road? This whole investigation kicked off because, for a handful of really determined people, it turned out not to be. Okay, so here's the twist, the real kicker. Even after being told the Irish healthcare system has nothing left to offer, some of these very same patients are getting advanced stem cell therapy. And get this, it's happening right there in Ireland. So how is that possible? That's the contradiction, the central mystery we're going to dig into. It really is a huge healthcare contradiction. How can these two things be true at once? Let's take a look at how this whole thing even came to light. You know, this story didn't start with a patient complaint. It actually started with a tip from an insider, a clinician at a private clinic in Dublin, and what they revealed was pretty shocking. Patients were showing up for treatment, but they weren't being sent there by Irish hospitals. There was no official referral. Instead, these people had to basically become their own private investigators, digging around online and hearing things through word of mouth. And the really critical part is that a lot of them were getting good results, so the big question is, how on earth is this happening? Well, the answer seems to be this very specific arrangement, a kind of UK referral pathway that creates what you could call a loophole. Okay, so here's how this cross-border loophole actually works. It's a four-step process. First, a patient in Ireland has to find and get accepted by a company based in the UK. Step 2, they pay that UK company directly for the treatment. Then, and this is the clever part, the UK company issues a formal referral back to its partner clinic in Ireland. And finally, the Irish clinic gives the patient the treatment, but they're just acting as a service provider. See, it's that separation that's absolutely key. It's what keeps the Irish clinic on the right side of the law. Okay, so that all sounds pretty methodical, almost like a workaround, which brings up a really obvious question. If this whole thing is helping people and it's technically legal, why all the secrecy? Why does it feel so underground? Well, the answer really comes down to what you might call a regulatory wall. There are some super strict rules that create huge barriers for everyone involved, both the clinics and the patients. And here's the legal term that matters, unlicensed cell-based therapies. Now, because of Irish and European Union regulations, clinics are flat out prohibited from promoting or supplying these. They can't advertise them. They can't even respond if you, as a member of the public, call and ask about them. Seriously, if you were to phone a clinic in Ireland and ask about this, they legally have to say, sorry, we can't help. So, what happens because of this regulatory wall? You get this massive information vacuum, a total black hole. Your doctors and the public system are only going to tell you about the official, approved options available within that system. They're not going to mention these other pathways, even though they're technically legal and accessible. And the clinic might be just a short drive away. It's wild. And as you can imagine, this information gap creates what can only be described as a really unfair system. A system where your health outcome doesn't depend on your diagnosis, but on what you happen to know. I mean, just think about this for a second. Let's picture two patients, patient A and patient B. They have the exact same diagnosis. Patient A listens to the official public information and is told, sorry, there's nothing more we can do. End of the line. But patient B, through sheer luck or persistence, finds the right information online or hears about it from a friend, and they get access to treatment through this UK pathway. Same illness, same country, completely different outcome. And this quote from the investigation just lays it out so clearly. Two patients with identical diagnoses may therefore receive entirely different outcomes based solely on access to private information. That says it all, doesn't it? The thing that decides whether you get care isn't your medical need. It's whether you are in the know. It creates this two-tiered system based purely on information. So, What's the point of bringing all this out into the open? Well, it's not to try and shut this pathway down. Not at all. The investigation is really making a powerful call for something much simpler: clarity and more transparency for the people who need it most, the patients. And that really leaves us with one final massive question. If some patients are getting good, maybe even life-saving results, why is getting access to it basically a game of chance? A lucky Google search or a whispered conversation? Why isn't this information just provided clearly and openly to people who are at their most vulnerable, people who feel like they have nowhere else to turn? It's a question that really puts pressure on the whole system to figure out a better way to help its patients.